Welcome back to The Full View. And now Union Hospersa, which represents more than 50,000 public service workers, it says, mainly in the health sector, has started rallying its members earlier to embark on industrial action next month. It comes after Education and Health Workers Union Nehawu protested yesterday at the union buildings over PPE and better wages. In February, you'll recall Finance Minister Tito Mboweni spoke about cuts to the public sector wage bill. After that, the state reneged on a wage increase agreement that it signed with the unions 3 years ago, saying there's just not enough money in the coffers. Hospersa says talks at the Public Service Coordinating Bargaining Council have now failed. We're joined by Kevin Halama, Public Relations Officer for Union Hospersa. Mr. Halama, so you've been lobbying members, rallying around some action. What's planned?
Good evening, Francis, and the viewers. From Hospersa's side, what we are saying is that it's time to stop the Jerusalem Dance Challenge in the public sector. It is time for members to now embark on industrial action. This is a call that we have made to all our members as the last straw, in that government is failing to come back to us with regards to implementing the salary increases as agreed in 2018. Instead, government has now slapped the faces of health workers who were on the front line by saying that enforcing this agreement will be unconstitutional. Now, as a union in the health sector, we do not understand this, especially after the sacrifice that our members have done all the way from March when we had the hard lockdown up until now. Our members are continuing to work in hard circumstances, and their salary increases have not been implemented.
Yeah. So this agreement was actually from the 1st of April 2020 to the end of March next year. So are people earning exactly the same as they did in March? There was absolutely no increase in April and nothing since then?
Yes, that's correct, Francis. There hasn't been any salary adjustments for public sector employees since the beginning of April up until this current period.
Now, you have this grievance. On the other side, people are saying, the state is saying that the coffers have run dry, and there's evidence of that. Our wage bill as well is high for countries of other countries, if you look at other countries of similar sizes. At the moment, we're borrowing money from the IMF. So some are wondering, why can't public servants, some of who are earning well, accept 1 year of no increase?
Look, Francis, I think the first item we need to address is the matter of principle, that there is an agreement that is in place which was signed in 2018. And the agreement is that at this particular juncture, in April the 1st, government should have implemented that agreement. Now, in 2019, instead of government planning properly to ensure that come the 1st of April 2020, they would have enough in the coffers, the government certainly didn't do that. Secondly, Francis, we know very well that there's been huge corruption and maladministration in the public sector. More so now with the 500 billion stimulus package that was announced by the president, where public sector employees have been watching almost every week, scandal after scandal around the looting of COVID-19 relief funds. Now, when you are a public service employee waiting for your increase and your employer is telling you that it does not have money, yet you are seeing evidence after evidence, case after case of corruption and maladministration, looting after looting. And more so, Francis, almost every single department in the country received relief funding of some sort, almost every sector. Now, what we are saying is that the healthcare workers were on the front line of the COVID-19 pandemic. Never mind the fact that you are saying that you can't implement the increase, but use that as a reminder on the importance of the work that these employees have played to where we are right now.
So you're using COVID-19, and that was important work, and we all appreciate health workers. But COVID-19 is also the reason that the state is using to say it's got no money.
That is not true, Francis. The employer came to us in February already, before COVID-19, citing that it doesn't have the money. To us, that's poor planning. If the employer did its job in 2019, we wouldn't be sitting here right now. Instead, what should have happened on the 1st of April, the increases should have been implemented, we would understand if the employer were to come to us now and say to us, it no longer has money to implement salary increases for the remainder of the 6 months up until next year, March 2020. That would be something. But now to show that the employer did not plan properly came to us in February before the COVID-19 pandemic hit us.
All right, this is all fair enough. But finally, what would you say to taxpayers who are the people who are actually paying for this, who have heard year upon year that our wage bill is actually a threat, that the credit rating agencies are concerned about the amount of money spent on the public sector, and now again, above CPI increases are demanded, above inflation increases are demanded, and this is money that won't go on things like fixing roads, on creating an environment for investment, nor will it go on helping many people who are unemployed in South Africa.
I think the message that we could send to taxpayers is that taxpayers should speak out in the ballot box when it goes to the elections and ensure that they put a government in place that will respect resolutions that it signs at the PSCBC, that will respect its employees, that it will manage the public sector properly. Because currently what we are seeing a government that is failing in its duties to implement the increases that were signed for, failing in its duties to ensure that the public sector is functioning and it does not have any corruption and maladministration. That's what we would say to the taxpayers. And unfortunately, Francis, there is absolutely nothing we can do at this point in time in that talks have broken down. Our members are gearing up to embark on industrial action.
When will the strike be, finally?
The strike will resume from next month. We are still lobbying with the other unions in the public sector as well to join this mass action to ensure that we bring a resounding halt to the public sector in all the areas, whether it's health, education, including other sectors which are represented by other unions in the PSCBC.
All right, strike action looming. Thank you very much. That was Kevin Halama, Public Relations Officer for Union Hospersa.